Welcome back, Dandy Clinicians. I'm Dr. Elizabeth Robinson. In this video, we are going to review scanning techniques to use in your office and how to evaluate your scans. Before we begin our lesson on scanning, I want to mention a couple of tips that will help you to achieve great scans. First, we do not want to use any loop lights or overhead chair lights. The scanner has an internal light, and any excess light can be reflected by the scanner and create a glare on your scan, making that scan unclear. We also want to control moisture during scanning to prevent glare and distorted images. To do this, you'll want to use the air-water syringe and suction before and during the scan to dry the teeth and the gums. Following these tips will ensure case success and good patient outcomes. We are now going to review how to properly hold your scanner, as well as some recommended scanning techniques. When you are ready to scan, you will remove the protective tip from the scanner by sliding it off and replacing it with your mirror tip. You'll want to hold the scanner wand like you would hold a pen or a pencil, letting it rest in the pocket between your thumb and index finger. Make sure that the power button is facing upward and is easy to access. A nice feature of the Trio scanner is that the mirror tip can be flipped up or down, allowing for easy scanning of the upper arch. Our Chairside software is always going to prompt you to let you know which arch to scan, as well as which way the mirror tip should be flipped. The typical order of scanning is going to be the lower arch first, and then the upper arch, and then the bite. We recommend capturing these scans of the lower arch, the upper arch, and the bite as preoperative scans before numbing your patient so that the patient's bite is not affected by the anesthetic. Once the patient has been prepped, we can go back and rescan the prep site. In this case, we are going to start with the lower arch, so we will check that the mirror tip is facing downward. When we are scanning, we want to insert the scanner into the mouth and make sure the patient is comfortable. We want to position the scanner parallel to the occlusal surface and hover it right over the occlusal surface without touching the teeth. Then we will press the power button to turn the scanner on. When you start scanning, you will hear a shutter noise that will signify that you are capturing images with the scanner. If the noise stops, we do not need to power the scanner off. Just move the scanner back to a reference point, like the occlusal surface of a tooth that you have already scanned. Once you recenter the scanner over the occlusal surface of a tooth, you should hear the shutter noise begin again. Continue scanning in your original path. To review, we will get in position, press the power button on, and then follow our scan path of occlusal, then lingual, then buccal. We will scan all the way across the occlusal aspect of the arch. Then we will tilt the wand in and come across the entire lingual portion. And then we'll tilt back over to the buccal and go across the buccal side of the arch. When scanning for the buccal surface, you will want to stop at the midline, remove the scanner from the patient's mouth without turning off the scanner, reinsert it on the occlusal surface of a molar, and then tilt back to the buccal side and pull back toward the midline to complete your buccal scan. When scanning, we want to remember to move steadily and slowly enough for the scanner to pick up the information we need. Try to move smoothly and not shake the scanner. Dry the teeth before and during scanning and try to retract lips, cheeks, and the tongue as much as possible. Once we have completed our lower arch scan, we are ready to focus on the upper arch. Before we begin scanning, we are going to flip the mirror tip so that the mirror is facing upward now. This makes it easier to capture data on the upper arch while allowing us to continue to properly hold the scanner. For the upper arch, we will use a different scan path, moving from the occlusal to the buccal and then to the lingual for our preoperative scan. Again, we will get in position, press the power button to on, and then follow our scan path. We will start on the occlusal surface of the most posterior back molar, moving along the occlusal surface of the upper arch, then roll the scanner toward the buccal surface, pulling to the midline. At the midline, you will again remove the scanner and place it on the other side on the occlusal surface of a molar, Roll the scanner to the buccal surface again and pull back toward the midline. Once you have completed the buccal surface scan, you will move the scanner back to the occlusal surface of a molar, then tilt the scanner toward the lingual surface and scan the lingual surface of the arch. After scanning the full arches, we are also going to scan the bite. To do this, we will insert the scanner in the patient's mouth against the inside of the cheek with the mirror facing the teeth. Have the patient bite down into their natural bite, press the power button to on, and then scan from the most posterior tooth up to the canine in an up and down brushing motion. You may hear a chime as you are scanning the bite. This chime does not mean to stop scanning. Keep scanning until you've scanned all the way from the posterior molar up to the canine. The chime means the scanner has automatically aligned the bite, but it does not mean that you are done scanning. If you hear the chime sound, then your bite has automatically aligned. If it has not automatically aligned, we can align the bite manually using Chairside. If your bite scan has not aligned automatically, your screen will show the bite scan, shaded all in blue, sandwiched between the upper and lower arch scans. To begin the manual alignment process, click Align Manually. Doing this splits your screen so that the bite scan is on the right and the lower arch scan is on the left. Looking to the far left, you'll notice that the manual alignment process is split into two parts. You'll start by aligning the lower bite scan first, then moving to the upper bite. To properly align, we will start by shifting the scans so they are facing the same direction. To do this, hold down the right click of your mouse and move the mouse as needed. You can also use the scroll wheel on the mouse to zoom in or out on the scan. Sometimes the scan is flipped so that the upper arch teeth appear to be on the bottom. If this is the case, simply flip the scan over and turn it around. Start by recentering the bite scan, and then you can move the arch scan so that they match. Once they're facing in the same direction, left-click on the buccal surface of a posterior tooth on the arch scan. We recommend finding an identifiable area on the tooth, such as a ridge or near the gum line. Then left-click on the same spot on the same tooth on the bite scan. To continue on to the upper arch, click Done, Next Alignment. Once the scans have been aligned, you can continue to move forward with your order. For a crown case, your final scan will be your prepped scan. We'll go over best practices for prep, retractions, and margins after a few more tips on scan technique. As you complete scans, you may see green areas appear on the scans. This green color indicates that there is missing information. If these green areas are in critical areas such as around the prep site or opposing the prep site, we want to rescan this area until there is no green left. Critical areas to capture in the scan include all of the crown margin, especially the interproximal areas of the margin, which can sometimes be easily missed. The second critical area is the interproximal surfaces of the adjacent teeth, because as you can imagine, the lab needs an extremely accurate picture of these areas so that they can make a crown with ideal interproximal contours and contacts. It is important to ensure that these proximal surfaces of the adjacent teeth are completely captured and do not have any jagged or uneven edges. When scanning for hard-to-reach areas, such as interproximal surfaces, we recommend using the twist technique. To do this, hold the scanner at a 45-degree angle to the adjacent tooth, and then slowly move it to the lingual, and then to the buccal, still pointing it directly at that proximal surface of the tooth that you are trying to capture. Once you have finished all of the scans, it is time to assess. We want to double check that the margin can be seen clearly all the way around on your crown preparation. Remember, what you see is what the lab sees. We recommend changing the color view to a monochromatic view on the scanner to help see the margin more clearly. Any areas that are unclear or obstructed by tissue need to be erased and rescanned before submitting your case. Here we can see some examples of what a good scan looks like, with the margin clearly visible all the way around the tooth. We also have some examples of what an obstructed margin looks like. Remember, obstructed margins can result in poorly fitting crowns or rejected cases by the lab. To keep your scan fast, we recommend keeping your image count below 12,000. This helps to ensure optimal processing time of our cases, as cases with more than 12,000 images can cause longer than normal processing times.